Raising a kid is a wonderful thing. I'm a daddy's man and I love my child. Even though I know how to raise my child, this program is great for parents that are just starting out.
And we are a part of a pipeline of services under the auspices of the Promise Heights Initiative, which comes out of the University of Maryland at Baltimore School of Social Work. Our primary focus is to work with pregnant women, expecting fathers in the community to make sure that they are able to have a healthy, full-term baby and one that is able to thrive.
Hi, my name's Michelle and I have 3 kids. This program has really helped me a lot about learning new things and about keeping my kids safe.
So the program started because there is a huge issue with infant mortality in the city of Baltimore and also within the state, but specifically within the city of Baltimore. Baltimore has the 4th worst infant mortality rate in cities its same size in the nation. And so to address that problem, the city decided to do some specific work within various neighborhoods, one of which is the Upton and Druid Heights community. And so there's a partnership, the Promise Heights Initiative, out of the School of Social Work that receives specific funding through CareFirst Blue Cross Blue Shield to do this specific work in the community to improve birth outcomes.
And I do feel that the program is a very effective program for women in this community. We support the moms throughout their pregnancies. We make sure that moms go to all their prenatal visits. We also do a mom and baby class through the Baby Basics teaching, Moms Club.
Moms Club is a weekly or a monthly meeting where women come together, pregnant moms or postpartum moms who already had their babies, where they learn about different topics, healthy living, family planning, but they also get to come together to support one another. A lot of women do not have support system, and in Moms Club they get to have that support system with other mothers and with the resource moms. They have someone who's there for them, who's looking out for them, who wants to see them succeed and who wants to help them out.
We're trying to prevent infant mortality, and we have been catching a lot of pregnant moms and helping them stay stress-free so they can deliver healthy, happy babies.
What to put in your bodies and what to not put in your body.
I haven't heard of any birth deaths, crib deaths, infant deaths.
What surprised me about this program was the lack of knowledge that some people had about keeping their babies safe. However, I was very surprised how open and willing many of the families were to accept our education, to accept our services.
We follow our moms from the time that they enter our office through their pregnancy and up until their babies are 18 months of age. That gives us a good time frame so that we can work with mom and baby to make sure that mom is doing everything that she can possibly do to make sure that her baby is being cared for. As far as once baby is born, baby is going to all of their well baby checkups, and that mom is still making sure that baby does have a safe place to sleep and that baby is still sleeping in their crib alone, and just reassuring moms on those days when they feel like they just can't do it anymore, that they do have a support system in the community.
Families welcoming us to educate them about how to keep their kids safe, how to have a healthy pregnancy. People tend to sometimes feel as though they know what's best for their families, they know what's best for them, but they're very open and willing to learn and accept the suggestions and education that we give them.
We catch a lot of the moms that's young. They're going through little issues, stress. Try to keep them out of domestic violence relationships. We have resources to help them. We basically like a little therapist.
So since we've been doing this work in the city, we are fortunate to say that the infant mortality rate has decreased within the city. We're glad to be able to report that currently the infant death rate has decreased below 10 per 1,000 live births over the past 3 years. And that decrease has been consecutively over those past 3 years. In addition, the work that we are doing specifically in Be More for Healthy Babies, Upton and Druid Heights, we are fortunate to say that we have had a 96% at-term or near-term birth rate for women who have been involved in our program.
I think a new mother who came into the program would learn that she can have a healthy pregnancy, she can have a healthy baby, and she can be the best mother for her child and still accomplish the goals that she has set for herself.
By us partnering with different organizations in the area, such as WIC and Total Health Care and the different clinics in the area, the rates have dropped. So it definitely is effective, and that's only by us doing our outreach when we go out into the community and make them aware that infant mortality is real and that it is a preventable death. Your baby does not have to die if mom and family are educated.
I would recommend this program. I did recommend this program to a young child. My child, she's 17, and she delivered. I'm a grandmother now of a 4-month-old.
And so what we're doing is a lot of outreach and education in the community to make sure that our community partners are aware of what it is that they can do to better support pregnant women and expectant fathers. And so some of that can be as easy as making sure that women have access to cribs once their babies are discharged from the hospital after being born. Another component can be just making sure that women and people who are living within a home with a pregnant woman or with an infant know that smoke can make it difficult for a baby to breathe, which puts them at increased jeopardy or risk of dying of SIDS as well. We're also making sure that women and men have access to family planning after having a baby, that they are able to have access to contraceptives so that they can have an improved birth spacing and have babies beyond 18 months after having a baby. Today we're with Antoine Dow, the owner of Cut Styles Barbershop here in Upton and Druid Heights. And Antoine is a very important part of the program that we do in the community and outreaching to men. And we're so fortunate that he has decided to partner with us. Antoine, can you tell us why it is important that dads are involved in this initiative?
Yeah, I think that it's very important because a lot of the fathers at my barbershop, they bring their own kids there, and a lot of them are raising their own kids. So the proper sleep habits are very important. You know what I mean? I have a son, I have 2 boys, Ramir and Nasir. My youngest one was a preemie, and I was laying him down incorrect when Miss Stacy Stevens came in the shop, educated me on proper sleep habits. So I try to educate my clients on proper sleep habits as well.
So Be More for Healthy Babies is glad to be an integral part of the Promise Heights initiative. We are the first component in the pipeline of services available to residents living in Upton and Druid Heights to ensure that families and children are born healthy, and once they're born healthy, that they are able to receive access to great mental health, great health, strong educational system, and economic development so that they can be successful as residents of Baltimore City.